All right, we're here with Doc Pawsitive, and we're going to show a cat neuter. This is a young male cat, probably about 6 or 7 months old. He's already been scrubbed. He's already been prepped. With these cats, instead of shaving their scrotum and causing irritation in their scrotum area, we actually pluck the hair. I didn't video that because most guys take offense when they see how rough we get plucking the hair off the scrotal area there. So we're just going to show the surgery itself. This cat has been masked down. We masked it down with a combination of anesthetic gas and oxygen. It's hooked up. This procedure is typically so short that we don't hook it up to monitoring equipment. It would take actually longer to hook the cat up to monitoring equipment than it takes to perform the surgery itself. So the cat is lying on its right side. We actually use a cold pack, a cold sterilization pack. We use a blade, and pretty much you use 2 instruments. You use the curved hemostat, a blade, and I'm going to ask Alyssa to get me a 4x4 here. And so basically what I do is I digitally push the testicles to the back of the scrotum, and then I make an incision in the scrotum itself. This is actually called a scrotal approach. And then we use our fingers and we push the testicle to the back, and then we retract the testicle. We retract the testicle quite a ways, and with this procedure that we do, we actually do not use any suture material. We pull on that, and this is where my curved forceps comes in. Because I use my curved forceps, I come underneath, I go around the artery and the vein, and then I clamp, and I actually use that to tie off the blood vessels. So, then we slide this down, and it's that quick on one side. We slide the knot down. Basically, we use the artery and vein to tie itself off. We pop that back in on that side. We come back over to our other side. We make an incision in our scrotum. We pop that testicle, push that back. We retract that testicle towards the back. We pull it. It has a point where it pops there. And then we use our curved forceps, curved hemostat. We clamp. We use our scalpel. We cut. We put the testicle over here. Now we have 2 testicles along with our blade. This cat is now neutered, and we slide that knot down onto, and basically this avoids the need to use any suture material, any foreign material in the kitty cat. It also speeds up the process, that knot. We make sure we tuck it back up in, and that's it. This cat is now neutered. We leave the scrotal, that scrotum will heal up quickly, almost overnight. There's no aftercare necessary. There's no suture material. The kitty cats tend not to lick it. We didn't shave it to irritate it. We didn't put any sutures in it to irritate it. These cats do really, really well, and they're back in action. In fact, when we remove the mask from this kitty cat will be awake in a matter of a couple of minutes. The reason to neuter these cats is not only it renders them sterile, they can't reproduce, they can't impregnate female cats, which should be spayed anyhow, but it also eliminates male cats tending to mark their territory, tending to urine mark, tending to spray, develop undesirable male behaviors such as maybe intercat aggression, wandering behavior. It just makes them much better pets. So it took longer to describe the process than it did, and so we're going to go ahead We'll remove the mask from this kitty cat. We take the kitty cat and turn off our anesthesia machine here. And this kitty cat is waking up, and he's now been neutered. Interestingly enough, black and white kitty cat, his name is Sylvester. Sylvester the cat, and he's on our cool black and white zebra print here. I'm not quite sure who picked that out, but this is a pretty straightforward procedure. Not a lot to it. Hits close to home for a lot of the guys who are going to watch, but it's absolutely necessary to keep these cats healthy and happy in our households. Bye now.